The reports of Pfizer and Moderna only last about 6 months. And then today, Pfizer saying you might need a booster, a third shot in a year. Make sense for somebody who says, well, I'll just wait a year and then get a shot then. Why? I'll just put on a mask and social distance and wait and see what happens. What do you say to that?
Well, the risk is, first off, I would say the risk of COVID is coming at you every day, right? And it's been coming at you every day for the last 14 months. The reality now is that the more people get vaccinated, the fewer places this virus has to go. And so you become a prime target if you're one of the people who hasn't been vaccinated.
Okay, so back up, because I think that this is important. Me getting vaccinated, I read that doesn't mean you can't get COVID, doesn't mean you can't spread COVID. So explain to me why being vaccinated gives the host virus less of a chance if you can still catch and spread it with a vaccine, 5% or 6% or 4%.
Really important distinction. So we don't have proof that the vaccine itself prevents the spread completely, but we have a lot of things that suggest that it does. We saw that in kids when they did the Pfizer study between ages 12 to 15, they actually did look specifically at, does it even prevent asymptomatic infection? And in those people, in 12 to 15-year-olds, they did not even get asymptomatic infection. That wasn't an endpoint that we looked at in the adult study. So that's why we weren't able to say conclusively. Okay. It's not to suggest that the vaccine makes it so that you still do get an asymptomatic infection. It's just that we couldn't say definitively that it prevents that altogether. So that's the difference there. And I think that it's important to note, I've heard that study referenced many times about how long the Pfizer and Moderna vaccines last, at 6 months, and it's been misrepresented time and time again. It's at least 6 months. It's not that, 6 months pass, at exactly 180 days, boom, there goes your immunity, you're back at square one. That is not what happens. It's that they didn't update. They looked at, for folks who vaccinated 6 months ago, did you still have antibodies? The answer was yes. And so they sent out a study saying, and even at 6 months, you still have antibodies. You may see an update 3 months from now that says, and even at 9 months, you still have antibodies.
Got it.
So that's the thing. It's not that there's no more antibodies after 6 months. Another important point, since people like to talk about timelines and how long things last, I like to point out how long COVID symptoms last. We know that at least 9 months after even a mild infection, almost 25% of people who had a mild COVID infection still have symptoms. Almost a quarter of people who just had a mild infection still having symptoms. The time it takes to grow a whole human baby, that much time passes, you're still having symptoms. Again, this vaccine, if you look at it on balance, its safety, its efficacy, its impact on preventing severe disease, preventing hospitalizations, preventing deaths, saving lives, keeping families together, keeping communities moving. Oh, come on, there's no comparison. The balance is this vaccine is important for our communities.
Sounds to me that they need Dr. Cameron Webb out there instead of the folk that they have out there talking, because it's too many people not being able to clearly talk about this. Now, let's just be clear. Dr. Cameron Webb, you have been vaccinated, because I remember when you came on before, you and your family, you were like everybody. J&J put on pause for a minute because of blood clots in 6 people out of 7 million, nearly 6.8 million people who have been vaccinated with the J&J. Which one did you get? I thought it was Moderna, if I'm not mistaken.
I got Pfizer. And at the time, mid-December when I was vaccinated, the very first day I was able to get vaccinated, Pfizer was the one that was available. Moderna hadn't even been approved yet, for use. And so I took what was available to me. My parents, who got vaccinated about 2 months after I did, on my strong recommendation, I'm their doctor child, and I said, please get vaccinated. For my parents, they got the Moderna vaccine. They took what was available to them. I have 5 siblings, and my siblings at this point, almost all vaccinated. Everybody's intending on it, but some of my siblings have gotten Pfizer, some have gotten Moderna, some have gotten Johnson & Johnson. Now, I'll tell you this, I love my family deeply, and I feel like every member of my family got a vaccine that will save their lives should they get COVID, and it'll prevent them from getting sick, getting hospitalized. And so I feel like they all got a safe and effective vaccine, all 3 of those that were on the market. And so that's kind of my take on it, just using my family as an example.
Now, the variants that are increasing, I saw a study that 90 to 95% hospitalization in Michigan. I want to say that state is overrun right now, and a few other states. Um, the more of us get vaccinated, the less the opportunity for the virus, even the variants, to catch. And then, like, so what are your thoughts
Yeah.
on these variants?
Karen, I have to say, in the time between when I was on here last and today, I'm starting to think that I'm gonna call you Dr. Karen Hunter. You know too much. You have clearly been in this deep in the weeds. So yes, the variants are increasing. We know that there are lots of different variants. They have weird names and numbers. So B117 was formerly called the UK variant, but the technical name is B117. That has emerged as the dominant variant here in the United States. And what's interesting about it is it spreads quicker, spreads faster. It's more effective at infecting people than the wild type or the original, SARS-CoV-2 virus that causes COVID-19. And so because of that, when it gets a foothold in a community, like you're seeing in Michigan, like we're seeing in parts of Florida, like we're seeing all over the country, when it gets a foothold, it spreads faster than that original version of COVID that did so much damage to New York City like last year, so much damage to California, so much damage around the country. So that's why this moment is so important. Now, in terms of those variants, what we know is we've tested the efficacy or how well that vaccine works against B117, now the dominant strain, and we know that the vaccine still works. So it's important for us to get folks vaccinated. What people need to know about variants is they don't come out of thin air. Every time a virus gets into a human cell, it recreates itself or replicates. And when it's recreating itself, sometimes it makes mistakes. Sometimes it'll copy something wrong. And when it produces that new version that has a mistake, a lot of the time that new version doesn't work at all. It doesn't survive. Sometimes it works a little bit better, and that creates a variant. And every time it replicates, there's the chance of there being a mistake and the chance of that mistake making the virus be a little bit better at infecting people and avoiding treatment with therapeutics like the monoclonal antibodies and avoiding protection from the vaccine. To stop that from happening, we need to stop giving the virus chances to replicate. Where does it replicate? Every time it finds a new person who hasn't had COVID yet. Every time it gets into a new person and starts replicating, it has opportunities to make a new variant and to have new mutated pieces of that variant that can cause a lot of damage. So that's why we keep saying we're in a race against these variants. We're trying to make sure that we are getting folks vaccinated so that the virus ultimately has nowhere to go. And that's why it's so important for folks to use this moment to get vaccinated.
UVA Medical Center's own Dr. Cameron Webb. Explain to me again, and how does COVID work? So it's airborne. We know that. I actually watched a documentary about the cruise ship. They knew back in February it was airborne, even though they didn't tell us that. We're busy washing bags and all kind of surfaces. It was airborne in February. So that means if somebody coughs or breathes, like what's the delivery system? Is it always spittle?
Yeah.
Is it
so a cough, a sneeze? So these droplets that we're describing, it's kind of respiratory droplets that are the cause, and that's how it's delivered the most effectively. Now, sometimes that can get on surfaces, and so that's why we say make sure you wash your hands. That is a way that the virus can be spread. And we know that it can survive for some period of time, different surfaces, different amounts of time, but can survive on surfaces for a while. That's why we were washing down our groceries back early on, because we were just like, we had that study that showed us that it can last on cardboard for 24 hours. So leave your Amazon package outside. After time, we found still far and away the most effective way it spreads is through droplets. It can also be aerosolized, and that's an important thing to mention, because I'm talking to you right now from the COVID unit at the University of Virginia. I'm sitting on the COVID unit right now. I'm in a call room, so that's why you're like, where is your N95 mask? So I'm in a safe space here. But what I'll say is that out there, everybody's wearing their N95 masks, because in any of these rooms, if somebody were to have a procedure, if they were to be intubated, have a tube put down, that aerosolizes the virus. And so it's different. That makes it smaller, and it can spread more effectively. And so so that's one of the things that we keep in mind. Wearing masks helps prevent the spread, but it's not just wearing a mask, if you're trying to stay healthy. Somebody else wearing a mask, if they do have COVID, they're less effective at spreading it. And if both of you have masks on, it's really highly effective. So that's why masks remain really an important part of that dynamic here. That's why, because it can get on surfaces, and because we have a tendency to touch our eyes and especially if you got allergies this time of year, or all those sorts of things. That's why it's so important to wash your hands regularly. And then that physical distance is that respiratory droplets, they don't travel 20 feet, they don't travel 15 feet. If you looked on average, staying about 6 feet away from somebody tends to keep you out of that general range of how far a respiratory droplet can go. Now, if somebody was really putting their back into it, yes, they could get a respiratory droplet to travel a little bit farther than that. But if you're looking on average, it's going to be less than that distance. And so those are the things that went into that public health recommendation, all the things that we're still telling people to do, because at the end of the day, vaccinated or not, those three things still will keep you safe from the virus. And that's why they remain so important. And
now,
one more thing I need to say
yes,
here.
please, Cam. Please, Dr. Cam.
Even if you've been vaccinated, we love the fact these vaccines, the Pfizer vaccine that I received, 95% efficacy. So if you take, 1,000 people who had that 95% efficacy, that means 50 people it didn't work in. And they don't know that because they got vaccinated. They posted it on social media. They're proud, they're happy, they think they are fully protected. But a 95% efficacy means that there's still some subset of people who think they're vaccinated, but they're not fully protected because nothing's perfect. You don't know if you're that person or not, still wear a mask. You want to think that you're in that 95%, but just in case, keep yourself safe, keep your community safe, especially while rates of spread remain high. We're still seeing high rates of community spread. So now's a good time to still keep yourself safe just in case.
You are, to this day, the most effective spokesperson for this administration. The J&J pause, when is it going to be lifted? And will it be, because now people don't want the J&J.
Yeah, so, it's interesting. There's been a love-hate relationship with J&J. I guess in the Black community, that goes back a long time. We loved us some baby powder. Then we were like, what's going on here? So
yeah, come on.
So I think that what's happening here, that pause is just evidence of how committed the administration is to keeping people safe. Because as you said, 6 cases out of 7.2 million shots delivered, that's less than 1 in a million, less than a 1 in a million chance of this outcome. It's called, it's a cerebral venous sinus thrombosis, which means a blood clot in the area where blood kind of drains from your brain. And what's unique about it is it's not just a blood clot like a normal blood clot. Usually with those, we give you a blood thinner to break that up. But this is in combination with low platelet levels, so it puts you at a higher risk for a bleed. And so it's a unique combination. And it happens to be a very similar unique combination to what we saw from the AstraZeneca vaccine in the UK. And so when you put it together, we're saying, hey, is this related to this vaccine in some way? I'll tell you, if you look at who this happened to, those 6 individuals, all women between the ages of 18 and 48, all white women. And so I think when you look at kind of who was affected, you say, well, that's just a small sample size. You can't draw any conclusions from that. You can't say, well, men aren't affected. You can't say 50-year-olds aren't affected. You can't say, people of color aren't affected. But what you can do is say, well, this can happen. We know that we're doing that deep dive into why it happens to these individuals, if it's connected to the vaccine, and what guidance we can give to providers, what to look out for, how to manage it, so on and so forth. So when that'll be lifted, that advisory committee on immunization practices, they did take some time to dig into that yesterday, and they came back with, hey, we need a little bit more time to tell you exactly how long. But I think that, when people talk about it shaking confidence, the fact that we took this action, we paused things, it should inspire some confidence in folks. I know I'm biased in saying that, but the fact that you've got less than 1 in a million chance of having, this outcome, if this is caused by the vaccine, and yet we stopped the whole program to investigate, to check it out. That tells you how committed we are to keeping people safe, making sure we know what's what. And so I think that's one thing that we want people to really pay attention to. This is who we are as an administration. This transparency is important.
And I asked you a question off mic about people with like autoimmune and pre-existing conditions. There's some notions out there that, several people have died and they feel like suspiciously it had to do with the vaccine because maybe they had some underlying conditions that, if your body's already fighting something, now you introduce this thing that puts the spike protein in, and creates this other warring faction in your body to fight this COVID-19 protein. Can you fight on 2 fronts? And does that make you more vulnerable when you get vaccinated?
Yeah, and I think this is first a conversation that should always be had with your doctor, really to dig in deeper about your specific circumstances. But that said, we often do tell people, if you're acutely ill, really sick, it's not a good time to get vaccinated because your body's busy trying to get well. But for most folks who just have a chronic medical condition that they're always fighting, This is a different thing. It actually can be really protective for you having this vaccine, because the damage that COVID would do to you far outstrips the damage that any vaccine would do. And so, you really want to protect yourself more than anything. It's a really important thing. I keep reminding folks, COVID causes a lot of damage, a lot of problems. This vaccine, we have had over 150 million people vaccinated at this point. We've received at least one shot. We keep that micro data. We keep information about who is vaccinated and what kind of symptoms they have and what impact it has. And we track that really closely. And we're not seeing anything shake out that says, oh, folks who have this chronic medical condition or that. The one thing we say is if you've had severe allergic reactions in the past, you're somebody who should take some caution. For everybody else, the risk benefit really falls on the side of being a real benefit to you. So talk to your doctor, but I think that for nearly everybody, it's going to be more benefit than harm.